Hi, this is Leonard Kish with Health IT TV. I'm here with Mark Scrimshire, who's an entrepreneur in residence at CMS working on a very interesting project. Blue Button on Fire, is that an accurate
yes. Chief Data Officer at CMS to build the next generation of Blue Button. So Blue Button came about in September 2010, where basically a beneficiary or a vet could log into their portal and download a text file and take it with them.
Right.
I mean, it was a great first step. What I've been asked to do is basically build a developer-friendly, standards-based API to deliver that data so that the beneficiary can point their data at applications, services, or research programs they trust. And obviously, looking around, CMS is a big entity in the health industry. They could create their own API, but we decided that there's a lot of movement around FHIR at the moment, the Fast Health Interoperability Resource Specification from HL7, and it just made sense that if the industry is starting to adopt that there's going to be tools and so on for working with that data,
right,
those data profiles. So we basically are building a Blue Button layer on top of FHIR.
So what's it going to take for me? Do most people have access to their Blue Button data right now? Who has access to it?
Well, it tends to have been a government-driven program. So if you're a vet, you can go to the VA, to your My Healthy Vet portal, and you can download your data. TRICARE offers the same thing for folks in DoD, and CMS did this for Medicare beneficiaries. So if you're a Medicare beneficiary, and there's 38 million of those, there's about 30 million that are registered on the mymedicare.gov portal, they could download their data. To date, there's been about 1.3 odd million people that have downloaded their CMS Medicare data.
So my mom takes care of our stepfather, and she carries around these 4 sheets. Has medications, the physicians that he sees, the test results that he's had, all in just pieces of paper that she's typewritten.
Yep.
And I'm sure that she's not alone in this, because that's kind of where we're at. So are people using Blue Button right now to get rid of those sheets of paper? I
tell the story of friends who were vets, and prior to Blue Button, when they traveled, they had an extra suitcase because that had their medical record, and now you can put it onto a thumb drive, put it onto your phone, keep it on your laptop, whatever works for you.
Right.
And so really what we're trying to do is say, this data's changing, and so as you go see a doctor, you get the latest claims information. Why shouldn't you be able to pull that down and either maybe you want to donate it to a research program, maybe that's of use. So, for example, the Precision Medicine Initiative, very interested in what we're doing. But maybe you want to pull that into your own personal health record. I mean, the point is what works for you. And what we're trying to do at CMS is not to create those apps, but to create the pipe, so that so the industry out there that's got some amazing innovators can basically grab hold of this data on behalf of the beneficiary with their permission and do something useful with it. And we're not trying to say this is what is useful. It's really for them to really, light up the imagination.
Have you followed the Office of Civil Rights within HHS and their new recommendations on patient access to data? How does that fit in with
I think it's really key. I mean, the whole issue around protection of data, we have a very serious responsibility at CMS to protect the beneficiary's data. At the same time, there's this requirement that a beneficiary should be able to point their data wherever they want.
Right.
So we've got to strike that balance, and that's where, again, we're using some of the technology stacks, like things like OAuth and so forth, and some other moves we're making to try and create a framework where beneficiaries can have some level of confidence in the applications that are out there, but at the same time not creating a scenario where we're effectively information blocking by saying you're not really a good developer.
You're right.
So that's really interesting, but I think the Office of Civil Rights is doing a great job in really getting that word out there that you as a patient have a right to your data. And I think what's going to happen is like the work that we're doing. Effectively with CMS, we're creating a model for how you could access your health data. Now, we'll just have claims data, but there's nothing to say what would happen if a hospital system came along and applied what we've built around the blue button front end, but was servicing up their clinical data. And that potentially creates a model that helps CIOs, CMIOs, and others around the industry to deal with this compliance issue.
We've talked a lot, actually, in the interviews we've done so far about how precision medicine, one, is certainly dependent on patients accessing this information, because you can't create a whole model of the individual unless the individual has that, and they're really probably the only ones that can do it. But the other part of that is value-based payments, and maybe something that is just starting to come to the fore is that you really can't do value-based payments either unless you have that whole picture of the individual, and providers can't necessarily create that whole picture, so that's going to fall on the patients also.
I talk about this, that I believe we're approaching a tipping point, and that traditionally the industry has been around basically pay for volume. You turn up in the doctor's office and they can bill for a visit, and now we're switching more to paying for outcomes.
Right.
Well, with the emergence of all the things like wearables, where now we're creating much more data about ourselves, you couple that with then the patient effectively becoming the hub, their own health information exchange, if you will, you're reaching a point where we as individuals will have vastly more information about ourselves than any one doctor out there. And at that point, you see this tipping point where now the doctors are incentivized to take that information from you.
Right,
because now they can, why do you have to come into the office if I can instead tap into your Fitbit and see that you are being active?
And then by providing that data, they're actually creating an environment where they can provide better outcomes and get higher reimbursements.
Yeah. So I talk about this being really a tipping point that we're heading towards.
Right. Well, there's so much now on population data and incentive payments. It seems like that's the thing at HIMSS this year. I mean, very, very on day one, to the point where you're not sure if it's just hype, but and people are trying to sell new products and things like that, which inevitably happens with health IT if you've been around long enough. But I think you're right.
I think we're looking at this has been something that's happened over the last 6-7 years. Is going on, so the way that the government has really changed the way payments are going to be made to move to more towards value-based payments. You saw the recession come along, and that drove a trigger towards high deductible plans. So now we're much more aware of what we're spending on healthcare, so we've become more interested.
Right.
All of these things are pushing towards putting us as patients at the centre, and I think the next wave are going to be tools that help us manage, because we don't want to be dealing with this stuff.
Right. Doctors, for the most part, don't want to be in the information management business unless it's improving patient care.
Yeah.
All right. Well, thanks, Mark. Great
Pleasure.
Conversation here at Health IT TV and HIMSS 16.
Thanks a lot.